Can you see that?
There we go. All right. All right. Well, everybody, welcome to the Recovery Task Force meeting. Bob is going to join us in a little while. Jason Smith, for those of you that are watching on TV with the Manhattan Area Chamber of Commerce. And I assume we are going to start again with roll call or...
Actually, we're going to skip roll call.
Okay.
We'll just verify who's participating.
Sounds good. So I think we will start with Julie Gibbs with the Health Department.
All right, good afternoon. I'm just going to give a quick update as far as where we're at with numbers, vaccination, and testing. We had 118 new cases and 98 new recoveries since last week. We're currently monitoring 196 active cases. We've had 190 breakthrough cases and 27 reinfections so far. As of yesterday, there were 6 patients in the hospital, 5 on the medical floor, 1 in the ICU on a vent. We did note that they are all unvaccinated. Our percent positive is back up to 7.06%. That's up from 5.54% where we were 2 weeks ago. That gives us a 14-day average percent positive of 6.28%. As far as testing, we are offering drive-up testing through collaboration with KDHE on Tuesdays and Thursdays from 10 to 4 in the mall parking lot. And this will go on through mid-October. We're in conversations right now with the mall and KDHE to be able to extend this throughout the weekdays, so Monday through Friday instead of just Tuesdays and Thursdays, since our testing demand has gone up significantly. Just to put that into perspective, we had 369 individuals come through the testing drive-up event on Tuesday, and that's the highest we've seen so far this fall. We are still doing symptomatic testing at the health department every day, so that number to call has not changed. It is 785-323-6400. And again, that's just for symptomatic individuals to get tested. We do rapid tests here with our symptomatic individuals so they can get results within 10 to 15 minutes. We are now offering testing on Saturdays. We just started this last Saturday. We had 12 people come through or actually come to the health department for testing. We're available 9 to noon on Saturdays through October. No appointment necessary. We can do rapids for those who have symptoms, and we can do saliva PCR kits for those who are asymptomatic. Let's see. We also have up-to-date information on our Facebook page as well as our website on where to get tested. So we've gotten a lot of questions from the community on, where can I get tested on a Sunday when the health department isn't open. So we have that information available on our Facebook page and website, and we'll keep that up to date. As far as vaccination efforts, we're still vaccinating at the health department on Thursdays and Fridays. So to schedule an appointment, they'll just need to call our appointment line. That is 785-565-6560. We're busy planning more remote clinics and now flu clinics. We're still waiting on our flu vaccine to get in, hopefully by next week, but we are busy planning clinics for October, which includes Oktoberfest, which we will have at the end of October. So more information will come out about that. We're hoping to be able to do the vaccine side by side. So COVID and flu, we can do side by side, hopefully starting in October. As far as the boosters, we're still waiting on more information on that. We had thought that maybe we could go ahead and start that next Tuesday, the 21st, but that's actually been pushed back since the advisory committee on immunization practices was set to meet this Friday, but they've pushed that back to the 28th actually. So we won't know any more probably until after that date. And that's all I have. Any questions?
Any questions for Julie? Karen?
Yes, I do. Julie, just to confirm, I think you said that, but I think it'll be important to reiterate again. When the booster shots do come, it'll be important for, if you received a Pfizer, that you get a Pfizer booster. If you had Moderna, that you get a Moderna booster. Is that correct?
That is the guidance right now. However, there's also been talk about being able to mix. So right now we're going with the guidance of, you have to stick with what your first doses were, but there's been talk about being able to mix. So that's another unknown right now that we still are waiting on guidance for.
Sure. Thank you.
I had a question for Julie. Thank you for the update. You mentioned this morning, I was listening on the radio about the percentage of individuals in the Romney County that were vaccinated and the data captured and how that might be vary based on where people receive their vaccinations. Can you speak to that a little more?
Yeah, that's a tough one to answer. It's hard to be accurate with that percentage. Right now, it's about 36% as far as Riley County residents who are eligible that have been fully vaccinated through our department or anyone that we've allocated to. So we've allocated doses to places like Barry's and Dunn's Pharmacy, Lifting Health Center. So they all enter in information into the same system that we do. So therefore, we're able to capture those numbers pretty easily. However, we know that far more than 36% have been fully vaccinated here in the community. According to the KDHE website, which is based on WebIZ entries, it's up to 50% have been fully vaccinated. And that is of course of Riley County residents who are eligible. So I think it just depends on where you look for that information. It's hard for me to give you an accurate number though, because our systems aren't talking to each other. Also with the WebIZ entries, that does not include any federal numbers. So like Fort Riley is not included in those numbers. We don't have, so we just don't have an accurate count, but I'm hoping that we are above 50%. I'm thinking that we are.
So for example, Hy-Vee may be one of those that might not be included.
It might not be. We've been talking with those entities early on to try to make sure that they're entering into WebIZ. We're hoping that they are, but yeah, it's hard to say at this point what an accurate number is.
Okay, great, thank you.
Julie, I've got a question. Per our obviously your update this morning, what does KDHE actually classify as a resident?
As far as, are you talking about if they're including students?
Correct.
I'm not really sure on that. That's a good question that I will need to clarify with them if they include our students as well.
Right. I believe that the per defined definition of resident of that is if they are an off-campus type of housing or Greek housing and can be considered here 9 months out of the year, which would fit that dynamic. I think that's what the census goes off of, but I don't know if KDHE goes off the same thing, because no matter what our numbers are going to be, they're going to be a little bit skewed potentially because of just that dynamic alone. That occurred to me after we spoke this morning, so.
Okay, yep, I will find that out for you, get back to you.
All right, any other questions for Julie?
I would just, one point on what John was referring to there on whether or not students are counted. If they happen to be using the 2020 census data, then it does include students because we were able to get them into the census data. So I don't know who knows again what they're pulling from the database, but if it is 2020 census data, students would be in there.
And I think, Linda, we had a pretty good, accurate indication of where we were in May when everybody left. So that student base that comes back would already be accounted for. Basically, we're trying to account student-wise for those new students, transfers, freshmen, et cetera, correct?
Right, right. And we know that number is a little bit down from the numbers that we previously had, like during the summer with the group that graduated in May.
Okay.
All right, any other questions? Well, Julie, thanks again for being with us, and we appreciate the update. I think we will move on to Linda to give us an update on Kansas State.
We're still moving full speed ahead with our in-class instruction. We've got the requirement is still in place for masks to be worn when on campus and indoors. And we will continue with that temporary requirement until Riley County is out of the CDC's substantial or high risk category. So I think Riley County was moved down to from high to substantial, but we need to be out of the substantial also before we would lift our temporary masking requirement. And we are continuing to highly encourage vaccinations and have several programs in place, incentive programs for both students and for faculty and staff to be vaccinated. So, and Lafayette is working to make it convenient for everyone to get their vaccinations there at Lafayette or where Riley County has the vaccinations being offered as well.
Okay. Any, obviously you had a big event last Saturday. Any issues, concerns?
We're watching it, but nothing as far as our numbers are still pretty low, for our positive, and because we do have some in quarantine and isolation, but the numbers are still lower than what they were last summer. And it'll take probably another week or so to see the impact after a gathering like a football game.
Okay. Any questions or comments for Linda?
I had one, Jason. Did we see any spike or influx from those that traveled down to Dallas and back? Because we'd be within about that time frame currently.
No spikes yet.
Okay.
So we watch it every day, and we're keeping where we're doing more testing too in the residence halls and on campus. But knock on wood, all seems to be pretty flat. So.
Okay. Any other questions? Ron, do you know if we were expecting somebody from USD 383 today?
Well, we only had about 4 folks that said they weren't going to attend, and that wasn't one of them. So okay. I don't know if Carla's going to make it or not. But I do recall hearing that the school board did extend their requirements that have been in place, I think, till well into October. I don't remember the exact date, but they continued the protocols that they'd had in place. I'm not sure they varied it very much. Julie, do you know more on that?
I think they kept exactly the protocol that's in place right now. I think they kept that in, and I think it's through October 15th.
22nd. Yeah. And they've got a dashboard or something set up that's open and public too, that kind of goes through real-time data. Is that correct? Okay.
Okay. Well, if Carla gets on, we'll ask her if there's any other updates. Ron, do you want to do anything from the city or?
Sure. I would just, we're keeping our provision in place that from administrative perspective for our employees and anybody that's utilizing city facilities, indoor city facilities, we do have our mask requirement in place for that. It's very similar to K-State's policy in that as long as we're in those higher thresholds, that will continue to be in place, and hopefully we'll get down to that yellow zone sooner versus later, so we can amend that. But that's no new information from us or any changes relative to that, and that's really the guiding principles from primarily our masking requirement. So if you're attending any indoor facilities for the city, that rule's in place, and also for our employees.
Okay, any questions or comments for Ron? Okay, so I was asked to briefly summarize the new vaccine mandate that came down from the White House on business. So I just went straight to the White House website and kind of walk through that, and then talk briefly about any reaction we've had. So the president had an executive order that will require all employers with 100+ employees to ensure their workers are vaccinated or tested weekly. That has been assigned to OSHA, or I don't know what OSHA stands for, Occupational Safety Health
Administration.
Something like that. So the way that is going to be administered is still being decided, and so we're monitoring that. Require vaccination for all federal workers and for millions of contractors that do business with the federal government. Require vaccinations for over 17 million healthcare workers at Medicare and Medicaid participating hospitals and other healthcare settings. Bob, is that, and Bob Koppel's with us now. Bob, is that an OSHA assignment too, or will that be administered by Medicare?
So I don't know that we know that exactly. We would anticipate that OSHA would have responsibility. The one caveat for healthcare workers is that the weekly test is actually not an option. You're either vaccinated or you're not going to work in healthcare.
So it's that's the difference in the large employer world. Okay, and then requiring employers to provide paid time off to get vaccinated. So we have not received any feedback from our employers in regards to this. I think they're in wait and see mode to see how the rules come down and how it's administered. We do know that a couple of the larger chambers in the Kansas State Chamber and Missouri State Chamber have both issued statements that they're concerned with it. But I've not engaged with any other local chambers or ED Corps that have made any statement regarding it. I also read another article just recently today that sounds like there's going to be some legal action against it as well. So I think this kind of wait and see on the required vaccination front, and we'll just we'll see how that plays out going forward. So any other comments or questions in regards to the mandatory vaccination?
Jason,
right.
I may make a couple of comments if that's okay.
Sure, yeah.
As a person who's actually trained and certified 48 hours in OSHA, I have a little bit of a background here.
Perfect.
I think there's going to be a real challenge on the legal side, probably not from the federal level, but on the private side. And there's 2 points with this that I think you're going to really get into the weeds about, and it's whether or not COVID's considered an actual occupational workforce, or I think you would consider it an environmental threat, but they're based off of standards that have to already be in place. And I think the fact that that's being done by executive fiat is going to make it a real challenge. I don't know how that'll work out. I know Arizona has already put forth a lawsuit, and I'm sure there's going to be several ones. And I think the other side that's tricky is OSHA, particularly when they're able to leverage a fine, which is $14,000, I think, per incident. It's being done administratively this time, and they have to be able to actually go in and actually be on site to do a full investigation per each one. And it's going to be very, very tricky, very, very cumbersome to be able to do that. So I think you can almost 100% know that those 2 points are going to be challenged. And how that works out judicially, I don't know. You're going to see those 2 points come to the surface for sure.
Okay, good point. Any other comments on that issue? Okay, Ron, did we have somebody that was going to talk about the rental assistance program?
Yes, I can do that. Let me share a different screen here. Everybody see that?
Yes.
So this is the Kansas Housing Resource Corporation website, and essentially the state has been administering a rental assistance program for quite some time. It goes back to the CARES Act last year, and have done, I think, a fairly decent job of that, as they've certainly processed a lot of payments. They got additional funding for rental assistance through the American Rescue Plan Act, and so they've continued to provide that. That's a situation where both the renter and the landlord need to apply for those funds, and it's pretty substantial assistance from a timing standpoint and amount. There are some eligibility requirements, and those are continuing. The state provides those funds directly to the landlord in this case. It also applies to utilities. So we've had a number of payments for customers through our water billing systems that where there's been assistance. So as people have fallen behind on some of those, that's certainly something that we make folks aware of as our customer base, of that assistance is there to have. And I think there is still some concern about, obviously, since some of the eviction moratoriums expired, about whether or not folks would be able to get assistance fast enough. So we're continuing to watch that. I know the state's been sensitive to that as well, and tried to put on some additional staffing to handle those aspects. We've tried to put out more education information about how you access it. A lot of our social service agencies locally who typically deal with these kind of issues are also well versed and can provide assistance in that particular area. So that's certainly a good tool that we have, that there's been a lot of participation in, really dating back to last year. One of the new components is this Homeowners Assistance program. And so this is a program where they're developing a draft for the calling the Kansas Homeowners Assistance Fund. And this is one where it will help with mortgage assistance. So if you're behind in your mortgage, again, there'll be some income qualifications of median incomes for that. But again, it can provide some significant help to homeowners to be able to stay up to date in their mortgage and in their home. This is currently under draft development, and there are some draft guidelines out there. And I had thought that this was going to be closed for comment this week, but I heard they are extending it. So I think you can still go to the Housing Resources Corporation website and submit comments. They do have a draft plan that you can access online too and provide additional comments. But this again is to try and keep homeowners in their homes and provide assistance for those that have been negatively impacted financially because of COVID. So not a lot of details there, but that's kind of where we're at.
All right, any questions for Ron?
Hey, Ron, this is Mike. Quick question. You know, what you see at both the federal level particularly, but also at the state, is quite a worry about the number of people who will be evicted. My assumption is most of this applies to rental housing. Then on the other hand, trying to find the statistics, the only ones I can find show that not very many people are taking advantage of this. You talked about the education piece. Are you getting feedback from any of the nonprofits and so on why the participation rate is so low?
Not to any great degree. I did note some information that the Manhattan Housing Authority put out that indicated there had been some substantial assistance already been made in Manhattan and Riley County in this area. Matter of fact, I think the Manhattan area accounted for 7% usage of the entire fund to date. So that's pretty significant. I think over 9 million has been provided to this area in rental assistance alone. So I think the word is getting out there, and the key has been, you know, it's not your traditional source of assistance where they get direct help from a social service agency, and it's about how they have to work with their landlord, and it's a good deal for the landlord too, because they can get an assured funding help as well. So that's the big difference. And I know in some other states, it's been a bigger bureaucracy of what are the qualifications and qualifying individuals for certain aspects, and they've tried to streamline that as much as possible. But I'm not hearing from our providers locally that that's a big stumbling block, nor have we heard from folks that it hasn't worked for them.
Yeah. Okay. Thanks very much. It just occurs to everybody that particularly the landlords, if you're not able to evict anybody, are bearing quite a burden for trying to hold on to the property and pay their taxes and all of that stuff. So hopefully we can continue to get the word out on this program.
You bet. And that's something we're certainly trying to do from our standpoint, is continue that educational effort. And I think I don't know the breadth of what we don't have is, what the breadth might be in that mortgage area, but certainly, making the financial institutions and other organizations that could benefit from that, and individuals that could benefit from these programs is certainly a big key.
Yeah. Thanks, Ron.
Yep.
Okay, any other comments or questions? All right, Ron, I think that's the end of our scheduled.
Yeah, I think we were just generally going to go around and see if folks had other items they wanted to talk about, or I don't know if Bob wants to get an update on the hospital.
That'd be good. And I apologize, I've got to sign off. So thanks everybody for being here.
Thanks, Jason.
Today's the day of tag team. So actually, we are, from a COVID standpoint, we're actually in a better place than we've been for quite a bit. We're down to 6 positive inpatients this morning. 5 of those are on the medical unit. 1 of those is in the ICU on a ventilator. What we are seeing is just high census, just of everyone else, which is good. Certainly want to be able to take care of everybody else as well. But just for the last, specifically the last few days this week, but really over the last few weeks, we've just seen a bump up in just patients in general. That is certainly still an issue with trying to transfer people, because we are not alone in that. It's kind of happening everywhere. So it's very difficult. Earlier this week, we had a patient with special thoracic surgery need. They were moved to a hospital outside of St. Louis because there was no bed, an ICU bed for that patient in the state of Kansas. And that was over a 12-hour period. So those things certainly happening. And everybody's trying, I do also give credit, I think everybody's trying to work together. The state has a mission control stood up to help place patients. And I think we might have talked about that on a previous call. That has actually worked really well. That has been really well done. Good coordination is good. They check in with every hospital in the state multiple times a day. We're feeding back information on our capacity, beds of what kind, and then they're trying to turf and get everybody placed. So that's actually been a successful thing, but it's pretty common anymore that we are holding people in the emergency room pretty much every day for a period of time, sometimes 12 or more hours waiting for a bed either here or outside of Manhattan. So again, that's probably the cautionary note there. And back to, there's been a question about, kind of what everybody's seen from the game. It actually doesn't surprise me that we really haven't seen anything yet. We're really at day 5. So if we are going to see anything, it would probably be by Monday, would be my guess. So it's good to see. I know Julie had mentioned this morning on the K-Man that we're actually seeing more people getting tested again. That is actually a positive, because otherwise we're all just kind of speculating, and that's the only way to get a good feel for community spread. So encourage people, especially if you're symptomatic, that's something to consider getting done. And it's free if you're getting it at the Riley County sites. So we always encourage people to do that.
Bob, this is Mike again. I know most of the clinics now are family physicians are encouraging flu shots, and they've got some drive-throughs open and so on. Have you seen any uptick in flu at all surrounding the hospital?
So actually, I'm not aware of any positive flus yet in our region, which is not surprising because we're still in the middle of September. That's typically later. Certainly a good idea though to get your flu shot. We'd probably maybe recommend waiting another week or two before you did that, just because everything has there's the end of the efficacy of the flu shot. So you want to push that as far into the winter as you can get. But we haven't seen that yet, Mike. And I know elsewhere in the state, I do believe we have had some positive flus already. I'd have to talk to our infection prevention nurse, but I do think either 1 or 2 counties in the state have actually had positive flus.
Thanks, I appreciate it.
Hey, Bob, this is John. On the subject of flu, we're getting some mixed communication on whether or not it's smart to get a COVID vaccine along with the flu vaccine at the same time. You know, they're trying to develop one, an all-in-one at some particular point in time, but with potential health complications for people and other variables, is it smart to do it at the same time, or should you spread those out?
So the guidance actually to this point is that it's okay to even get them on the same day. There is not a combination, and I would guess we're at least a year out from that, because you also have some different manufacturers who make flu shots versus those who make COVID, and we're going to have to get everybody kind of together on that same page. But no, the guidance has been, because there's been a conversation about the boosters and when would that be approved or whatnot. And that's what kind of led to that conversation, because it's starting to look like it's going to be in October if boosters get approved. The meeting is tomorrow. That's kind of a key meeting with the FDA to make that determination about the Pfizer boosters. You know, me personally, I guess I'd be curious enough to see about the side effects or after effects of getting a vaccine. I don't know. I would do one at least in each arm. I wouldn't do them in the same arm, just to try it out. That's just me being curious about that. We don't really know what third booster shots are going to look like for patients, because we really have for immunocompromised folks, those got approved back in August. We have actually given some of those to either physicians or staff members who are immunocompromised. But that might be a total of 5 people or 6 people at this point. So we just don't know enough about what that even looks like. I haven't, of the 5 or 6 people, I've actually heard of nobody having the side effects like some people had after their second shot. I actually haven't heard that. So I don't know, we'll have to kind of wait and see what that would be. If we do get boosters approved, it is still recommended if you've previously vaccinated at any point actually had COVID, it is still recommended that you get a booster. And for those who are immunocompromised in the community, you can go to the pharmacies, you can go to the Riley County Health Department. We are recommending people do that. That we do think is very prudent. That should be done fairly quickly if you are immunocompromised. Don't put that off. That would be our advice.
Thank you.
Sure. And I apologize for being late, guys. Had another kind of conflict, so that came up not planned.
Hi,
Ron,
Bob.
Ron, this would have been the day to get treats because there's a small group.
It is. So sorry about that. We sent out several notices.
I know. No, we all have schedules. Hey, Kelly.
A lot of people have a lot of other things going on, for sure. And I think Kelly wanted to say something.
Yeah, just to kind of clarify for maybe that are, people that are listening in, Bob, Julie had kind of mentioned earlier about the booster, and there hadn't really come out, I think, any kind of true guidance on getting a booster. If you had the Pfizer, it needs to be a Pfizer. If it's a Moderna, it needs to be Moderna. And I'm also curious for people that got the J&J, how that's kind of looking and shaping up as well.
So at this point, other than those who are immunocompromised, it's actually not approved. There's none of the vaccines are approved as a booster unless you're immunocompromised. So actually tomorrow the FDA has their hearing meeting, whatever the right term is, on approval for a third dose of Pfizer, or that booster dose as we all refer to it. We're anticipating that there'll be some kind of same meeting or hearing about Moderna probably about a month from now. Most of the Moderna paperwork and process is like 3 to 4 weeks behind Pfizer's. So that's why I'm saying that. If it's approved, then actually starting the 20th, which is that Monday? Yeah, so if the boosters would be approved, then as early as Monday, they would start through some sort of sequence of who would go first, et cetera. And I read something this morning, there's an anticipation that they might do just approval of a booster for a subset of people, like our nursing home residents again, healthcare workers, kind of start working down through that same prioritization or triaging, if you will, of those who have a lot of exposure to the public in their jobs, that sort of thing. It's hard to say. So I think there's been some people that you might have read earlier. There's a group that said, we don't know if the boosters are really, if they're really needed yet. And then there's a study and some data coming out of Israel that would say, if you do this, there's actually some pretty good protection, pretty good results. I just don't know. It's hard to project when that might be. Johnson & Johnson is kind of an interesting question too, because their approval of that product was, over 3 months behind Pfizer and Moderna initially. And so we'd anticipate that their process of collecting data and making their application is probably going to follow in some sort of similar time gap. So that might be around the end of the year before, if that's going to be proposed, that would even be proposed. I would say it's probably inevitable that there'll be a conversation and an approval in some form for a booster for all the products. The timing of that, I think that's a fair question. And who goes first again? All those pieces.
Thank you.
Sure.
Hey, Bob, I just want to clarify, are they having that meeting tomorrow? So I've heard I thought Julie had mentioned that they postponed it and it may not happen on Monday.
So that, you know what, that was my reading before 7 a.m. this morning.
Okay.
I haven't had a chance to sit down and look at news feed or anything to see if there's been something that changed. It was originally scheduled for the 17th.
Okay, I think they may have postponed that, so that probably isn't going to happen on Monday, but let's keep our fingers crossed, the sooner the better.
Karen?
I was just going to share with you information as our community takes a step forward with returning to normalcy. I'm going to share with you what our STAR report showed as a result of Kansas State football being back. And last Saturday, we had a 92.3% occupancy in our hotels, which is a good thing. Now, to put that into perspective, I get this week by week, and that made day 10 of a 90 or above occupancy from the beginning of the year. We've had a few things that conferences that they had good attendances early on in the second quarter. So we're a long way from where we have been in the past, but again, it's a glimmer of hope, and I really appreciate everyone counting the days. How's that going to spike? I went to the game. I thought that the crowd was well behaved. And people were respectful of one another. And I'm a bleacher rat, so sitting on that bleacher, it was people behaved themselves well. And you trust everybody was vaccinated that you were sitting around.
So I know in some sections that was actually part of the conversation prior to the game. People were actually talking about that. So I think, if nothing else, I take that as a positive too. People are willing to engage in that conversation and just visit with their neighbors, because the season ticket holders are going to be seeing, they're going to be with the same people all season. So,
Right.
I mean, I think that's a good thing. Have that dialogue.
I did see that Georgia got added to the state travel list. So if you travel to Georgia, you're subject to the quarantine requirements. I think the state did that on Monday. You know, Bob, in the past, you've shared with some of us the kind of the Kansas Hospital Association's graph that shows that, are we continuing to spike? I know you hear capacity issues and staffing issues at a lot of different Kansas hospitals, depending on where they're at. But I know I get some information from Stormont Vale, and they've certainly had staffing issues and had to turn a lot of requests away for services from, as you said, many other states, and you've had to go clear to St. Louis to get a patient in a appropriate specialist.
So we have seen, there's what Ron is referring to. We get some data from KHA, and it's like a moving 7-day average. And so we were showing over the last almost 4 weeks, pretty substantial increase in that moving 7-day average of new hospitalizations. And what we've seen over the last like 7 days is that it's either leveling or even starting to just turn down a little bit, which is obviously that's positive. Our own internal system, not obviously our census, our internal census here in Manhattan, and then we share data with amongst our Ascension Via Christi hospitals. Everybody is seeing just a little bit of a curve down. Our curve down is actually more substantial than any other of our locations in Kansas. So we continue to live in a little bit of a good bubble here, that's a great place to be, right? One more reason it's a great place to be here. But that's encouraging. We're just still kind of watching. We talked about this before. There's kind of this phasing of, first you get a lot of positives in the community, then you get hospitalizations, then you get fatalities, and then things improve. So we are certainly in the hospitalization kind of stabilizing. Regrettably, the fatalities across the state are actually been going up. We've had 2 patients that we cared for here that have passed this week at higher level facilities past us, and they've been there for a bit. And they're not actually from Raleigh County, if you're wondering. Because we're taking care of people from all of our surrounding counties. So that's probably the troubling piece of this still. We've got a ways to get out of that curve. So we just got to watch that.
Thanks.
I guess the other thing, just if people are curious, we are definitely seeing younger people. On our COVID patients yesterday, I think the oldest person was 52. Which for many of us on this call, that's some reassurance, right? But that is definitely the trend. We have hospitalized 30-year-olds, 40-year-olds, and 50-year-olds now. That is definitely a shift from 6 months ago. Still not a positive thing because we even have patients, but definitely seeing a younger patient population, and that's concerning for lots of reasons. This is our working age population who are now becoming victims of COVID. Ron had kind of started. Are anybody else in the group? And I know we had a small group today. Either observations or something you'd want to share from your organization, or observations. Your niche or part of the community.
I actually have one, Bob. Just want to share the Raleigh County side. Nothing much like the city of Manhattan. All of our policies are still currently in place, but in order to kind of understand the direction and decisions we may need to make moving forward, depending on what happens, we've kind of gone in internally and tried to figure out what our vaccination rates have been. And it was a real challenge, kind of surprising in some aspects. But I can pleasantly say that Raleigh County right now is sitting at an 84.1% vaccination rate. And I understand with the health department and EMS and first responders, that's, you know, it's going to set the bar a little bit higher, but I've been pleasantly surprised by how all the other departments are up and above 70% too. So I just wanted to pass that along as we're all working together to try to get those rates up. I feel like we're trying to do our part in that equation as well.
It's Kelly here again. I guess, you know, from my perspective, you know, in the restaurant industry here and seeing the public every day, you know, I see a mixed bag of people, you know, either wearing masks or not. I see a good chunk of children and typically at least one parent wearing masks when they come in. We have not had any issues at all in regards to, you know, for lack of a better word, harassment, you know, or anything of that nature. You know, I left it up to my staff whether or not they wanted to, if they were working in the front of the house and having direct contact with customers, whether or not they wanted to, you know, wear a mask. We're all vaccinated here. There may be a couple of people that we have recently hired that we are unsure of, but we're all front of house and back of house. We're pretty much, I would say, 98% vaccinated. So I told essentially for two of my girls who have young children at home who don't have an opportunity to get vaccinated, I encourage them to definitely be wearing their mask, just, you know, for protection, you know, just that extra layer there. But I see it kind of being 50-50, you know, with people walking through the door. And so just to kind of give that update on what I see here.
Actually, Kelly, I've got maybe one or two questions for you. Maybe you can help answer. How is workforce working for you? Are you able to keep fully staffed? Has there been any issues in play with that? And in terms of, I guess, getting food and the other things that you need to operate and run a restaurant from a shipping side, are you having any issues there?
Well, if you saw me in live, I'd be going ha ha ha. So staffing wise, to be honest, we have not been aggressive on trying to hire. We have, you know, been very lucky by word of mouth for people that we have recently hired. And to be honest, we're still maintaining probably our operations right about, I would say right about 70%. You know, we still are not going full bore like we have pre-COVID, and probably don't plan to for quite some time. I will say that we have gotten ourselves into some pickles, you know, on certain shifts where we have been, you know, a bit shorthanded because, you know, people have requested a bit of time off or for whatever reason. But, you know, we just kind of, you know, strut ourselves way, you know, through there. Distribution, yes. We, you know, had with Cisco, which I don't know, you all may have heard here probably about 5 or 6 weeks ago, pretty much told restaurateurs, you know, any businesses down in the Wichita area that they would not be delivering until further notice. And they literally just gave them maybe 24 hours notice. You know, and we also saw that once again related with, you know, our big distributor, Cisco, that they quit delivering up in the Chicago area because of the union. So, you know, there's these big entities, these big companies such as Cisco, and, you know, I can't speak for US Foods and Benny Keith and, you know, some of them, but yes, they are definitely have some major labor issues. And we almost, you know, weekly, you know, find that we can't get product, or because or we get product and it's the wrong product. And, you know, so they've just really have decided that they are going to cut out their smaller market and concentrate on, you know, I guess restaurants that have a bit larger market. However, they are not going to be distributing to real large markets either. So it becomes down to labor. So as an example, we are, you know, as of, I don't know, probably 4 weeks ago, we had to have X amount of cases, couldn't go below that amount of cases for delivery, but we also could not go above a certain amount of cases to be delivered. And so once again, that has to do with the labor end on there. They just can't find warehouse managers. They cannot find drivers. And, you know, even though they are offering upwards to $30 an hour for warehouse managers and workers, you know, truck drivers that can, you know, probably, you know, earn up well over, you know, 3 figures. Yeah, they're just not finding people that want to do it. I can tell you some of my, you know, beer distributors that directly deliver to us here. I've had one of my reps have to literally deliver to all of his, you know, companies himself, because they had somebody not show up or the person got fired. So it goes, you know, large and small. But yeah, just a lot of, I think a lot of companies are realizing that even though they were as large and, you know, and big as a company such as Cisco, you know, they found that, I mean, they're letting, you know, people that they've worked with for years, you know, just smaller entities, you know, artisan groups and, you know, things that, you know, they're having fire sales on that and they're not buying anymore. So it's just, they're reshaping how, like we all are pivoting to some degree on how we do business and how we look at it. And so, yeah, it's an ongoing issue, you know, John, and, you know, I'm sure that you hear that quite often from your, you know, constituents. And, you know, I just find that, not to be long-winded here, but I know that this has been a topic of discussion and people felt that, you know, getting the unemployment, you know, and this and, you know, all of that, you know, so-called incentive, you know, to kind of keep people afloat. You know, people found an opportunity to probably get into another career. And there's so many, you know, you don't have to go to a technical school and you don't have to go to a 4-year university anymore. You know, I mean, you can go onto Google, you can like go onto, you know, I mean, you know, other, you know, colleges that may offer certificates, you know, to where, you know, you can get certified for a reasonable amount of money and time. And I've also found that a lot of people have started up cottage industries. You know, people that were working, you know, you know, in the plumbing industry or, you know, the construction industry, you know, maybe they just all got laid off. I literally have had people tell me that they just started up, you know, a cottage industry business. And that is just like, and they're, you know, it's just, that's what they're doing. And so it's just a really interesting, you know, time to see how technology has been able to redirect, you know, some of our choices, you know, work life habits, you know, work choices. So yeah, so that's I think that's just a nutshell there, John. You know, people, it doesn't come down to you know, just the unemployment money. It just that people, when they, you know, got laid off, maybe the company couldn't pay, get that unemployment to them quick enough, you know, whatever their, you know, pool may have been in that industry, you know, they had to, you know, pivot to something quickly. So, yeah.
I think you explained that very well. Thanks.
Other feedback? I think right now, let me look ahead here. I think we are scheduled for October 14th for our next meeting. Does that still work for everybody to plan for? It's the second Thursday. Same time.
I don't know, there might be a conflict on an event that's going to take that place that day.
There is, Linda. I'm wondering if we should move the task force back a little bit because there's a North Campus corridor dedication ceremony.
Yeah. Right now I've got that from 1 to 2:30, so
yeah,
which would involve several of us here.
Yeah. Could that be moved? Could this meeting be moved back to possibly 3 to 5?
Well, we can either
or go to the next Thursday.
I was gonna say we can just move a week, or I mean, it's going to be up to the 10 of us. So, well, no, I mean, what's, you know, whatever works for us.
The 21st, would that be all right?
I know we have some podcast recordings that Jason would probably say no to, merely because it involves other folks and him.
Well, the one thing we could do, I mean, do we need an hour and a half anymore, 2 hours? What do we?
Probably
right at an hour. We're right at an hour.
We're right at an hour right now.
So maybe we could do
good.
that afternoon from, say, 3 to 4.
On the 14th?
Yeah.
That's fine. I think that'd be fine.
Linda, I know, I think on the calendar, is that the day for Cash Unite? But it's going virtual now, so that's probably wrapping up towards the end of the day.
I know the MBF community liaison group meets at 3 that day as well. That some folks are on.
Do we look at the 21st to do 3 to 4? Or does that still have that same conflict, Karen?
Yeah, his calendar still has that. He has it from 1 to 4.
Well,
how about
I apologize for getting on late. Was the school district having their continuation go through October 22nd? Is that what somebody said?
Correct.
Do we want to shoot for the 28th then?
That's actually what I was thinking, Bob.
We go to the
cleaner.
Well, yeah, because K-State, you're really just, it's metric driven, so you don't really know when things might start or stop. Or the city is the same way.
Right.
Yeah. Do you guys want to do the 28th? Is 2 o'clock or 3 o'clock better going forward? Because we can certainly come back to an hour now. I would agree with that.
And we're talking about October 28th?
Yes.
Correct.
Yeah, look good any time on that afternoon. So.
Yeah, and that looks okay on Jason's calendar too.
So 2 to 3, 2 to 3 or 3 to 4?
Either one.
I like the 2 o'clock. This is Kara.
Okay, so 2 to 3.
We've been consistently 2, so let's just kind of stay there. And you know what we talked about too was ultimately kind of putting together some lessons learned and some takeaways and ultimately some recommendations. So I might encourage everybody, and we'll do an email to the whole committee about this, is just starting to write down some thoughts about you know, especially in your own particular area of representation, what you know, if you had guidance for somebody that was buying your business or going to sit in your chair, and what is this discussion? What's worked? What hasn't worked? What needs to be tweaked? some of those aspects that I think would be a compilation of thoughts that we could ultimately hand back to the city commission and the community, for that matter, for whether you're in healthcare or government, education, all of those things, hospitality, I think would be important components to at least document a lot of our discussion. That sound reasonable?
No, I think that's a good idea.
Sounds good.
All right, sounds good.
Okay.
We'll give you some time back, and we'll get a note out to get everybody to hold that time and date with the some of those thoughts to look forward to sharing, and hopefully we'll be in yellow or better.
I just want to say it's really great to see everybody. You know, it's like I said before, breaking up can be really hard to do. So I really appreciate, you know, letting me be part of this group. It's been an honor. So thank you very much.
Thanks, Kelly. Great to see you too.
Thank you, guys.
Take care, everybody.
Good afternoon.
Thanks. Bye.
Bye.